As we've announced earlier, the 51 cases overnight are an increase in what we have experienced in the last few days, and it serves as an important reminder that new clusters can still emerge, especially in workplace settings amongst unvaccinated or partially vaccinated people. And Dr. Coleman will provide some further information on the new cluster shortly. But it serves as a timely reminder that if you are not yet fully vaccinated, please be very cautious over the coming weeks. Now, as we foreshadowed yesterday, our public health response will evolve over the initial stages of our exit from lockdown. And Dr. Coleman will provide some further details shortly on how test, trace, isolate and quarantine will change. And of course, this will have implications for the focus of work of our very hard-working contact tracing team. And this will start to change from Friday. The goal of the Territory's public health response over the coming weeks and months will be to manage COVID in our community and to support our health system. Another goal will be to achieve a successful economic recovery. And our public health response is absolutely critical to underpinning that economic recovery. High vaccination coverage, compliance with the ongoing restrictions, and a continued strong public health response through effective test, trace, isolate and quarantine measures, although they'll be changing, they still need to be effective, are the three key levers for us to manage the next phase. On vaccination, the ACT is clearly on the path that we need to be on. However, even with our high levels of vaccination, there are still high-risk settings where it's important to ensure that everyone is vaccinated. Residential aged care and public health care settings are two examples that have already been implemented through public health directions. Today, the government has announced that vaccination will be required to work in early childhood settings and primary schools for individuals interacting with students. AHPPC, the national body of our Chief Health Officers, is also preparing advice for National Cabinet to extend mandates to other high-risk settings, and this includes disability care. We look forward to receiving that expert advice and enacting it across the nation. Testing will continue to be an important part of our local public health response. So if you have any symptoms or you are identified as a close contact, whether you're vaccinated or not, you should be getting tested as soon as possible. Waiting days to come forward to get testing can have a dramatic impact on the sort of treatments that are available to you if you do test positive. Now, Canberra Health Services have advised this week that they've had people present to the emergency department who have had symptoms for days but have not come forward until they were so sick that they required emergency treatment. There are too many people ending up in hospital or in intensive care who may have had a very different experience if they'd come forward for testing when they first got symptoms and the virus was able to be detected sooner. Now, our public health directions are going to play a part in maintaining access and capacity within our public health system. So as we move through the phases of our pathway forward, businesses can expect that compliance with these directions will continue to be enforced. Now, yesterday, our COVID compliance teams visited over 60 businesses, and nearly half were found to have some level of non-compliance. So we'll continue through these teams to educate, to work with businesses to see a higher level of compliance as we step through our next phases of the pandemic response. We are coming out of lockdown on Friday. Things will change, but we do all still need to stick with these public health measures. It's really important that we do so. COVID-safe plans need to be developed for each business as they recommence operations, and information to assist each business with preparing that plan is available at the ACT Government Business Hub, so that's online at the COVID-19 website. ACT Police will continue to be active, working in partnership with New South Wales Police around compliance on cross-border matters and compliance within the ACT. Now, yesterday, nearly 1,500 traffic stops occurred, and there were 40 directions to leave the ACT. So these activities are going to continue, and police will join us tomorrow, ahead of the end of the lockdown, to outline the compliance activity that they'll be undertaking as the lockdown ends.